Hello, this video today is going to talk about the difference between the term sex and the term gender. So sex is going to determine the biological difference between males and females' reproductive organs, while the term gender determines how a person identifies themselves and maybe even how they dress. So this video is specifically targeted for respiratory therapists that may face some situations in the clinical aspect where a patient identifies themselves as a different gender than their original sex. It's very important to be respectful with these patients. If you are not, perhaps they may not be as receptive to receive your care, and them not being receptive to your care may slow down the diagnosis, or may even slow down the treatment of that patient. So it's very important. Stay tuned for an example.
Can you? I'll be right back. Sorry. Candy White? Hey Ashley, the EKG you told me to do, you told me 212 was Candy White, but I just walked into 212 and it's not, it's a male patient.
Yeah, well, her name is Candy White, but she's transgender, so she identifies as male.
Oh, I see. I'm gonna see if she's okay then for me to do the EKG. Hi there, I'm sorry about that. I had to go grab something else. My name is Daniel, I'm from Respiratory Therapy, and I'm here to do an EKG on you. Can you go ahead and verify your name and date of birth for me, please?
Yes, it's Candy White, 8/11/1986.
Okay, so just so you know, the procedure is an EKG. I'm going to be putting on some electrodes on your chest, and as long as you're okay with it, we're going to go ahead and proceed. Is that all right?
Well, is there a female available that would be able to do this for me? I don't know if I feel comfortable with a male.
I understand. Let me go see if she's available. Let me go grab her, okay? Hey Ashley, I went back into the room and told her if she was okay with me going ahead and doing the EKG. She says she feels more comfortable with someone else doing it, like a female. Would you be okay to go ahead and do that?
Yeah, absolutely. Hi, Miss Candy White.
Yes.
Hi, my name's Ashley. I'm with Respiratory. I understand that you wanted to have a female do your EKG, so I'm here to do your EKG. Is that okay?
Yeah, that's fine. I just wanted to make sure. I know I asked for a female to do this, but is there any way you can try to avoid revealing my breasts?
Yeah, absolutely. So let me tell you what I'm going to do. I'm going to go ahead and put some electrodes on your skin. So what I'll do is I'll go ahead and just expose you here, and then I'll just pull your gown up to right here. And that won't expose any part of your breast. Is that okay?
Oh, okay, I see. Thank you.
Yeah, so I'm going to go ahead and perform that, okay? Is this comfortable for you?
What's that?
Is this comfortable for you?
Yes.
Yes.
Thank you.
These are just the electrodes that are going to go on, okay? And then I'll go ahead and put everything else on. just gonna go ahead and clip these on now. You still doing okay, Candy? I'm gonna go ahead and put some on your legs. All right, hold real still for me. Awesome, we got it. I'm gonna go ahead and take these off, okay? All right, Candy, we're all done. Is there anything I can get for you at this moment?
No, thank you.
You're welcome. Have a good day.
Some things to highlight about this video. As you can see, the first respiratory therapist to see the patient was a bit confused about the identity of the patient because the patient appeared like they were male, but the name that the patient had was a female name. So after clarifying this with the female nurse, he goes back and tries to perform the EKG on the patient. The patient then says that they are not comfortable with having a male perform the EKG, and so he respects the patient's wishes and tries to see if he can find an alternative to have another nurse perform the EKG. Another thing we observed in the video was that although we had a female perform the EKG on the patient was still not fully comfortable to having her chest revealed. And so an additional step that we can take even as males, when we have to perform an EKG on the patient and they're female, we showed a good tactic there to not reveal the entire chest site and to perform the EKG in a way that is not as invasive to the patient's privacy. What we saw was the gown came up to the chest area and also came down to the chest area. We were able to kind of work our way around the situation and continue to respect the patient's privacy. That concludes this training video. I hope you all enjoyed, and please remember to be respectful with any type of diversity that you may encounter in the healthcare field.